Good evening. My name is Dr. David Doman, and welcome to another edition of Housecall. What are the healthcare disparities for the African American community in Montgomery County? Find out more right now. My guest this evening is Mr. George McFarland, president of McFarland and Associates, who has a major role interacting with the African American Health Program of Montgomery County. George, welcome to Housecall.
Thank you. Thank you for inviting me.
My pleasure. So briefly tell our viewers about your professional background.
Well, first of all, let me say I'm originally from Mississippi, and I came to Howard University in the 60s, and I went to undergraduate school and graduate school in social work there, and I got very involved in social policy and analysis. And from that experience, I got very much involved in contracts and grants, primarily with the federal government and subsequently with state and local governments. And in this case, today I'm representing the African American Health Program. Several years ago, I won a contract from the Montgomery County government to help to reduce health disparities in Montgomery County. So this brings me to the conversation today.
Excellent. Let's start out then by reviewing in broad brushstrokes, what exactly is the African American Health Program?
Well, basically, the mission of the African American Health Program is to reduce the health disparities that exist between people of African descent in Montgomery County and the rest of the population. There's great concern that there are great disparities, and although I'm happy to say that Montgomery County has some of the healthiest residents in the nation, nevertheless, there's a big gap in terms of the quality of life and the length of life of residents based on the ethnic background of those different groups.
And that's an interesting disparity and concern when you consider that Montgomery County is one of the most affluent counties in the country and one of the most educated. So how can that disparity exist in such circumstances?
Well, I think a lot of it is historical, and certainly I think racial discrimination and poverty and all of these other factors combine to really highlight and amplify the disparities. And I think one of the interesting things that the COVID-19 brought to bear in a big way has been the underlying health conditions and the disparate number of deaths and hospitalizations that exist. So we know that there are a lot of social determinants that get in the way of people living their best lives. And so we know things like social class and education, income. We have such big disparate differences in income and education, housing, food availability, health insurance, and other factors that really make access to health care more difficult. So when we have big differences in all of these social determinants, they guide us into different levels of quality of life and health.
You make a good point that the COVID-19 pandemic has brought to bear a lot of these issues. For example, when the CDC appropriately recommended everyone socially distant to reduce the risk of infections, when housing is a problem for members of the African American community, when you have large families that reside in relatively small residences, I would imagine it's very difficult to socially distance and reduce the risk of infection within a household.
Yes, that's a really big problem, and unfortunately, people of color tend to be overrepresented in terms of the vulnerable populations who didn't have sick leave, didn't have annual leave. They were the first ones to get laid off, and many at the same time in other segments, uh, they really didn't have they couldn't continue to their work with they couldn't work from home. So they all of these things increased their exposure and vulnerability to infection. And as you mentioned, because they live in close quarters, they were more likely to be able to transmit the virus to members of their families. So that's again speaks to the whole issue of socioeconomic factors and social determinants that really undermine both the quality of life and access to care and the risk of living shorter and sicker lives.
What are some of the risk factors and behaviors that are a challenge to the community when it comes to healthcare disparities?
Well, we know that poor nutrition is a major factor, and in some ways that intersects with access to quality foods, uh, more likely to be fewer grocery stores, in certain segments of the community where there are large African American populations, say particularly like in White Oak, where we have large populations. One of the largest zip codes would be 20904. And there are very few grocery stores, which mean there are very few choices, and also the quality of the food. I know that a lot of the issues around, for example, cancer, having to do with eating processed foods, eating foods that are very poor in nutrients, um, eating a lot of meat and things that are not particularly helpful in terms of promoting health and wellness. We try to really talk to people about particularly adopting plant-based diets as a way of fighting cancer and also promoting cardiovascular health, um, reducing the chances of diabetes, and also exercise. Very often, the communities that I'm talking about, in particular, they're not designed to promote a lot of walking. Don't have walking trails, things of that nature. Very, very often, there's not a clear understanding of the role of the individual in controlling their health. Like, for example, knowing about the importance of controlling their blood pressure, cholesterol, A1C, and those things, and getting in at least 150 minutes of exercise every week.
So, what kind of community outreach could be done to help members of the community?
Well, one of the things we do is we host a lot of virtual health events. And there used to be events that were at recreation centers, at churches, and actually we're beginning to open back up now where we do routinely, we screen people for hypertension. All too often people don't realize that they are struggling with hypertension, and we teach them how to manage and control their blood pressure. We do classes around exercise and nutrition to help control the blood pressure, A1C, all of those biometrics. They very often they don't know the importance of knowing their BMI. We say over and over, make sure you know your numbers and keep up with your numbers. We rely a lot on technology, particularly remote patient monitoring, especially now, to have our clients and patients keep up with their blood pressure, their BMI, and steps walked, and all those kind of things, and put them on their phone. And more importantly, communicate with their primary care physician on what their measurements are, and be able to display them and show them uh, if there have been critical values that need to be discussed or looked at. So that's what we try to do is increase the engagement between the people we serve in that primary care position.
Just a quick explanation for our viewers. BMI stands for basal metabolic index, which is a parameter that measures obesity. And hemoglobin A1C is a blood test that is a predictor of diabetic risk. So do you think that with the pandemic winding down, you'll be opening up more community health clinics around the county?
Yes, we will. In fact, we have an event Saturday. We work with a lot of churches, and sometimes these events, now that we are in the summer, we're more likely to be able to uh, work outside. So we reduce exposure to the virus if we are working outside. So we also do HIV tests. So we also think everybody ought to know what their status is at all times and what their risk factors are. So that's really important. And also, I want to underscore the importance of mental health screening, because we know that there is importance in emotional health, that physical health and emotional health intertwine and intersect. And so we want to always stress the connectivity between the two. And we know that the leading causes of of death, like cancer and cardiovascular health, are also affected by emotional status, and issues like depression and anxiety can further undermine health-related risk.
We're going to pause briefly for a public service announcement. More with my guest, George McFarland, and we are discussing healthcare disparities for the African American community in Montgomery County. We'll be right back.
If you're even considering getting your high school diploma, go get it. You can do it.
Find free adult education classes near you at finishyourdiploma.org.
We're back, and my guest this evening is George McFarland of McFarland and Associates. We are discussing healthcare disparities for the African American community in Montgomery County. George, when we paused for the break, we were discussing different aspects of this challenging topic. Share with our viewers some of the health indicators that are predictive of healthcare disparities.
Well, one of the most important ones have to do with infant mortality and maternal deaths. We see a big gap in the rate of infant mortality for women of African descent and mothers in Montgomery County. We have a program called SMILE, and that program is aimed at reducing the likelihood that a mother will deliver an infant that is not full term, or that is premature and not of a healthy weight. what we do is we start with the mom, hopefully at the first trimester, and we try to we meet with her weekly, monthly, to try to get her to do the right things to ensure the likelihood of a healthy pregnancy. And this is especially difficult now because we are seeing a trend towards having the first infant, a first birth later in life. So it's also at a time when the mother has more likely developed certain chronic diseases. We see increases in obesity and hypertension, gestational diabetes, and these are factors that make the pregnancy more problematic. And of course, I talked earlier about having insurance. We have more mothers who are immigrants to this country and may not be insured, may not be have clear legal status in this country. They are reluctant to go use some of the informational resources, like having they may not have a social security card, a driver's license, may not have family support, access to transportation to get to and from a doctor's appointment. So all of these things we do, we try to get them to go for their OBGYN appointments. And then we follow up with them for up to a year after the baby is born. Very often they they won't release them from the hospital without a car seat. Sometimes these mothers don't have a car seat. They don't have the funds to buy a car seat. We'll get them a car seat. We'll get them insurance to for the delivery. We'll get them a crib. We try to discourage co-sleeping because we know that that can result in sudden infant deaths. And then there are other indicators. One of the leading causes of death, particularly among people of African descent, as well as all people in this county, is cardiovascular heart disease. Major problems. Again, I talked about earlier about the prevalence of hypertension or the silent killer. And that's something we can do something about. And we talked about, I'm sure, uh, you do a lot of procedures that have to do with gastrointestinal kind of issues. And we know if people eat healthier, that some of those problems can be reduced and people can live longer and be less likely to be hospitalized. We can reduce the problems of diabetes, which is a huge problem. We think that with the growing and continuing problem of obesity, it's going to be a big problem, a bigger problem, I should say. And we have about 80 million people in this country who are now pre-diabetic but don't know it. And so what we try to do is let you. We're now trying to focus more on pre-diabetes and keeping you on this side of the fence so that you don't move into the category of being diabetic. And if you're pre-diabetic, we try to move you further from where you are closer to the normal range of A1C. Oral health. I haven't said a thing about oral health. Oral health is the area where we have the greatest disparities. Dental care is so difficult to get um, because it's not, often not covered by insurance. And all too often, um, uh, inadequate oral health care relates to a lot of problems. I'm sure you see a lot of people who've lost all of their teeth at a relatively young age and then being able to eat solid foods, whole foods like apples and fruits in particular may be more difficult just because they don't have their teeth. and Medicare will pay to take the teeth out, but they won't pay for those to put them back. And so that's a very expensive process. So that's a big problem. And I talked about mental health. Um, you know, you talked about earlier about the pandemic and the consequences of alienation, isolation, social distancing, um, not being able to go to the churches, the congregate living arrangements, um, being with friends and loved ones and grandchildren. Um, you know, I have grandchildren and I haven't seen them in a good while. I haven't seen them often because now they're sort of back in school and it's been a long delay. Yeah, all of those kinds of things. At a time when I think stress and uncertainty about the future, people have lost jobs. A lot of people aren't able to pay their rent. And the fear of eviction, I think it's the end of June that um, the situation may become more dire if people haven't paid the eviction um, delay may be resumed. I think things like that. And so all these things undermine overall health.
What about some of the parameters that reflect health and wellness? What are some of the things that you focus on?
Well, as I say, exercise is very important. We we also do food cooking demonstration, similar to what Rachel Ray does, or some of the other people who have these cooking shows. What we try to do is show people how to prepare food that is very nutritious and healthy at the same time, and promote. Our slogan is that food is medicine. It's less likely to be toxic. It won't have, if it's very nutritious food, you won't see all of the warning label signs that you see on the pharmaceutical drugs. So we try to say, focus on getting most of your medicine out of eating nutritious foods. So we think between exercise and food and knowing your numbers will keep you out of the hospital and keep you out of the emergency room.
I think what's so interesting is all these things we've been discussing, all these factors actually interplay, don't they?
They certainly do. Because when it's interesting. I was talking to another colleague yesterday, and she was saying, well, why don't you just focus on one aspect of life? And I say, you can't, because all these things interplay. And if you are feeling depressed, I was just reading a new announcement that was uh, looking at the effect of anxiety created by learning that you have cancer. Once you, at first, understanding the diagnosis and first hearing that you have cancer or that you have had a stroke, uh, the depression that comes with that, the interplay between particular diabetes and depression, we know it's a strong intersection between the two. And very often people get very discouraged because they feel like they have decided to change their lives, but they're still, their numbers are not falling within the normal range. That is very distressing and very discouraging and very often very depressing.
Sure. You had mentioned earlier the pandemic shining a light on these healthcare disparities. And I think some of the unique aspects of the disparities when it comes to the African American community is the relationship with the medical community has not always been equivalent to other ethnic groups. Is that true?
Yes, it certainly is been a lot of distrust over the years and uncertainty. So I think that building that trust is going to take some time. We're all watching the fact that we seem to have achieved significant progress in getting people vaccinated. But now we have hit this point where we are not seeing the kind of success, the early success that we were registering at the earlier part of the pandemic. I know that a lot of state and local governments have actually closed down the large pavilions where they were beginning to vaccinate people because nobody's showing up. And we're now down to the more difficult cases. And so, uh, we have years and years of distrust to overcome. And I think, we have to start somewhere. And I think that we also don't have enough of people of African descent involved in the healthcare delivery system. So that also serves as a barrier. In a lot of the areas, we have 2 or 3% or 4% of the providers who look like people, the people who are reluctant to come in. So I think that's a big challenge, and it's going to take a lot of effort to turn that around.
You make a very good point. Unfortunately, we're out of time. I want to thank you for your superb interview. If our viewers have any questions, how can they get more information?
Please call the African American Health Program at 240-777-1868. That's 240-777-1868.
Thank you, George, for an excellent interview.
Thank you.
I want to thank George McFarland for providing some excellent information this evening. I want to thank my team at the studio. And of course, I want to thank you, the viewer, for welcoming us into your home. Tell us how we're doing. You can reach me at my practice website, montgomerygastro.com. As for our next show, it's going to be David Del Pozo, who is the program director of the Latino Health Initiative. And we'll be discussing healthcare disparities for the Latino community in Montgomery County, which should complement this show very well. Anyway, I do look forward to seeing you next time for the next edition of Housecall. Good evening.